All right, good morning, everyone. Welcome to our third HTO in Action event. We're thrilled to have you join us at the series we're rolling out over the next year. Today, we're going to be digging into the implementation area of housing and food. So before we begin, a few housekeeping items. Please do ensure that your lines are muted for the duration of the event. We have quite a few folks on today. Feel free to introduce yourself in the chat, give your name and pronouns, and what brought you to today's event. We definitely love an active chat, share information and thoughts, reactions, resources, make friends, ask questions. You're welcome to have your cameras on or off, and we will have this meeting recorded. And that's with the exception of the breakouts. So slides are going to be sent, and link to the recording is going to be sent after the event. So closed captioning is available in English or Spanish. And so we're going to drop these links into the chat for you, but please feel free to click on those. All right, so before we begin, I want to share OHA's acknowledgement to community, starting with the tribal lands we call home. We acknowledge that what we now call Oregon is the ancestral lands of many tribes, those now federally recognized and not. We are here because this land was occupied and its traditional people were displaced by colonists and settlers. As settlers and/or guests, we recognize the strong and diverse Native communities in our region today, from tribes both local and distant, and offer respect and gratitude for their stewardship of these lands throughout the generations. If you'd like to take a look, you can go ahead and go to nativeland.ca, and we invite you to explore that map. And there you'll find, you'll be able to learn about and acknowledge the tribes that are in and from your community. Okay, thank you for being here to share with us and each other and how we can advance health equity. Here at OHA, we're really trying to do our work differently, and we thank you for your graciousness and as we learn. So we acknowledge that there are institutional, systemic, and structural barriers that perpetuate inequity and have silenced the voices of communities over time. OHA is committed to partnerships, co-creation, and co-ownership of solutions with communities disproportionately affected by health issues, so they can actively participate in planning, implementing, and evaluating efforts to address the health issues. OHA recognizes community engaged health improvement is a long-term and dynamic process. OHA is striving to engage with communities through deliberate, structured, emerging, and best practice processes. And OHA is striving to make engagement with public health effective for communities, especially for those communities that experience institutional, systemic, and structural barriers. Okay, so for the purpose of the HTO and Inaction event, so today is actually the third in a series of 8 events we're putting on over the next year to highlight the strategies and activities identified for implementation of Healthier Together Oregon. So the purpose of these events is to convene partners from around the state who are working to help advance health equity. It's really an opportunity for us to dig a bit deeper into the strategies and activities of this plan, to share examples of the work in progress, and also to connect with others. So in terms of our agenda for today, so the agenda is really going to be in 3 separate parts. First, we're going to provide a brief overview of the Healthier Together Oregon plan and strategies within specifically the housing and food implementation area. Next, through the magic of Zoom, we're going to have breakouts, and we're going to have an opportunity for you all to connect with each other and connect with other people in the state who are invested in this work. And then finally, we're going to turn it over to partners who are doing this work. We're really fortunate today to be joined by partners from Oregon Housing Community Services, Rogue Food Unites, and Sage Metro Portland. Go ahead, Christy. So the first thing we want to really talk about is our implementation framework. So for those who are less familiar with the Healthier Together Oregon plan, here's basically a framework that summarizes what it encompasses. So HTO is a 5-year plan to advance health in our state. We know that a lot of the strategies that are within the plan are long-term, but the plan itself is a 5-year plan. And 5 priorities have been identified for the plan, and that's institutional bias, adversity, trauma, and toxic stress, behavioral health, economic drivers of health, such as housing, transportation, and living wage jobs, and access to equitable preventive health care. So the way the plan was developed was there was a subcommittee for each of those 5 priorities. And as they developed the plan, they often saw the interconnectedness of these areas. For example, we can look at disparities in discipline rates in education with the lens of institutional bias, and we can look at the benefits of restorative justice in schools from a trauma and toxic stress lens. However, they're really both related to youth. So in order to organize the aspirational, innovative, and exciting ideas that have come out of the subcommittee under each priority, we've developed this implementation framework that really speaks to this interconnectedness. So 8 areas of implementation have been created to help organize this work, and we're going to go over that on our next slide. And then progress toward our goal of equity is going to be really measured by 16 indicators. And then also 62 strategies with underlying activities are going to be our work. And if you're curious about the indicators or all the strategies, you can go visit them at healthiertogetheroregon.org. So next, we're going to talk a little bit about the implementation areas. So for equity and justice, it's really direct state agencies to center priority populations, especially Black, Indigenous, people of color, and tribal communities in the planning, policy, and investments. Housing and food, which we're going to be talking about today, really addresses housing insecurity, housing instability, and food security. Behavioral health, this is really focused on mental health within the Healthier Together Oregon plan. There are some strategies that are specific to substance use, and those are found in the Alcohol, Drug, and Policy Commission strategic plan that was developed at the same time in a parallel process. And healthy families, this is strategies really related to shoring up family resilience through preventive services, early childhood education, home visiting programs, and support for caregivers. Workforce development, this is strategies to ensure diverse, culturally responsive workforce. It's through standards, training, and hiring practices. Healthy communities, which that really speaks to the built environment and also talks about social resilience and economic development. Healthy youth, this is addressing bias and disparities, as well as preventive services and health services and education. And technology in health really focuses on electronic health records, telehealth, and also the efforts in the state around community information exchange. So we're going to be focusing on each of these areas in future HTO and Action events. So for our priority populations, we had originally 5 priority populations, and then our partnership recently added a 6th one. So the partnership, it's an external steering committee that really guides our decision making for the plan. It's made up of representatives of priority populations and also implementers of the plan. And this month, the partnership added a 6th priority population, which is immigrant and refugees, to recognize these really unique needs of immigrant and refugee communities, especially in relation to some of these strategies. So the priority populations in the HTO plan are Black, Indigenous, people of color, and American Indian, Alaska Native, people with low income, people with disabilities, people living in rural areas of the state, people who identify as LGBTQ+, and as I said, immigrant and refugees. And we also want to say that we recognize the intersectionality of these populations and that individuals may fall within multiple populations. So in terms of what we're going to do next is, that was just kind of a general overview of the HTO plan in general. And now what we really want to do is give you an idea of the strategies and activities that are falling under the housing and food area of the plan. So Christy, go ahead. And so this is the first one. So there's really 6 strategies, that 3 for food and 3 for housing, they're really focused in this area of the plan. And we're going to kind of go over each strategy. And then we're also going to let you know some example activities that have been proposed. So for the first one is under housing is increasing affordable housing that's co-located with active and public transportation options. So some example activities might be incentivizing development in higher opportunity areas. It might be supporting implementation of regional initiatives and addressing zoning barriers, which we know are barriers to affordable housing development. So the regional supporting housing impact fund, what that does is it pools contributions. It's from health systems, from philanthropy, and also from business partners to increase availability of deeply affordable housing with services and also to support housing stability, especially with those folks who have complex health needs. And to give you an idea, the current partners, they're Care Oregon, Central City Concern, the Collins Foundation, HealthShare, Kaiser Permanente, Meyer Memorial Trust, OHSU, Oregon Community Foundation, the Portland Business Alliance, and Providence. So you can kind of see it's really a mix of these different sector partners that are coming together under affordable housing. The other local initiative that's mentioned here is the Portland Housing Bond. So that's an initiative with 12 projects, and it's going to total almost 1,500 units of affordable housing. Members of the public can attend the bond oversight committee meetings if you're interested, and they're currently held virtually. The next meeting is going to be October 7th, and we'll provide some information about how to participate. And then also speaking of active transportation, because the strategy really speaks to housing and transportation both. So the ODOT, what's happening within ODOT right now is ODOT is updating its transportation plan for the first time in 15 years. And the decisions that are going to be made are going to impact the next 20 to 25 years of transportation planning. So the policy coordinating, it's going to be this process that really lasts for a couple years, but the policy coordinating committee is starting to meet and it will have its first meeting today. They're inviting public comment within the meeting as well as verbal and written comment outside of the meeting. So if you're not able to attend, you still have the availability to give your voice to this process. So information about the meetings and where to find the recordings if you missed them are in a link that we'll provide. So we just wanted to kind of give you a couple opportunities too for participation if you're interested in looking into some of these things that are happening in the affordable housing area. All right, the next strategy is about increasing home ownership among Black, Indigenous, people of color through existing and innovative programs. So when HTO was developed, it was intentionally aligned with existing work. So this strategy is a direct overlap with the work of the statewide housing plan from Oregon Housing and Community Services, who we are going to hear from later. So some example activities from this plan are to expand and explore innovative new programs that address an unmet need in the marketplace. So that can really be down payment assistance, it can be manufactured home products, insured mortgages. It's also to engage with culturally specific and culturally responsive organizations to help connect communities of color to these programs. And we know that that's already starting to happen now. So that's starting to happen a lot with the rental assistance programs, and that's going to continue to happen with the homeownership programs as well. And then also targeting homeownership and asset building resources to affordable rental housing residents. So that might be in the form of individual development accounts. So we're going to share some links about the individual development accounts, which you can check out as well, as including how to find an individual development account provider. So that's the second homeownership strategy. And the last strategy under housing is requiring housing first principles to be adopted in all housing programs. So housing first is essentially a service model best practice. So it's an approach that quickly moves people from homelessness into independent and permanent housing, and then also provides additional supports and services as needed. So an example activity is incorporating housing first language and dedicated targets into funding agreements. And this strategy emerged from the behavioral health subcommittee. It could also possibly expand to include other activities to support houseless individuals in their transition to permanent housing, or also possibly activities related to houselessness prevention, because we know that that is definitely a key and growing problem in Oregon. And then finally, we'll talk about a little bit about some of the food strategies as well. So there's three food strategies under the plan. This one is increasing access to affordable, healthy, and culturally appropriate foods for Black, Indigenous, people of color, and low-income communities. So this could really include expanding local educational programs that grow their own food. And there's some really great BIPOC-led organizations that teach people how to grow their own food. A couple examples are Mudbone Grown, which is a Black-owned farm enterprise, and also Raices Cooperative Farm, which is a project of the Next Door Inc. in the Gorge. And both of those are really great BIPOC-led organizations that teach people how to grow their own food. Also, another potential activity is really expanding awareness of and access to available programs. And we have quite a few programs in the state that are available. Then SNAP, WIC, there's the National School Lunch Programs and the School Breakfast Programs. There's also quite a few summer lunch programs. Some are based out of schools, some are based out of parks, and then there are others based out of community-based organizations. And then finally, the Child and Adult Care Food Program. So this activity really, the second bullet really speaks to a couple different things. One is awareness. Are folks aware of the programs that are available in their community and their food supports that they can access? And then the other one is really about the barriers, and that's kind of the access a piece of it. So access is distinct but related. So are we really addressing these barriers for individuals who need to access these food supports? So the next strategy centered around food is maximizing investments and collaborations for food-related interventions. So we know that there are all of these assessments that really look at food security in communities in Oregon. So community health assessments that are related to community health improvement plans. There are tribal food sovereignty assessments, the comprehensive community needs assessment, and then there's other required assessments that are really tied to federal programs and federal funding, and also local programs. And so the idea is to really collaborate and make sure that we're really benefiting from all of these assessments that are happening at different levels in the community, and that folks are aware of what issues are being brought up and the data that's coming out of each of those. So that's kind of speaks to some of like the maximizing collaboration. And then there's also within this strategy, the investment piece. So we know that there is purchasing happening for food. There's purchasing for schools, correctional facilities, hospitals, institutions of higher learning, homeless shelters. So we know that there are all of these different purchasing that's happening. And so the idea is really to leverage this collective purchasing power to make sure that we're ensuring that there's really healthy food available in these places. So go ahead, Christy. Okay, so the last strategy is really around, that's related directly in the housing and food area, is really around building a resilient food system. And this is about building a resilient food system that provides access to healthy, affordable, and culturally appropriate food for all communities. So example activities within this, it could be convening regional food policy councils. We know that there are quite a few food policy councils in Oregon. So convening them to collaborate and be able to share information with one another and strategies. Could be increasing programming and financial support for local and food production and consumption. And this is a lot of what folks think of as some of those really ground level interventions that can happen to increase food security in communities. So it could be food hubs, could be community gardens, could be locally sourced food RX or veggie prescription programs. There's a really great veggie RX program in the Gorge. So it's really increasing those and making sure that those are supported and sustainable. And then finally, within building a resilient food system, we always want to talk about supporting tribal food sovereignty, because we know that supporting tribal food sovereignty is really a key piece of being able to have and build and sustain that resilient food system. So in addition to, like I said, in addition to sort of the housing and food strategies, none of these are in a vacuum. We know that housing is a really large area. We know that food security is a really large area in itself. And so a lot of these areas are interconnected. So even though these are the housing and food strategies, we definitely know that there are quite a few strategies that are really related to what's proposed under housing and food. So some of these under healthy communities, there's co-locate support services for low-income people and families like that are at or near health clinics. So this could be something as simple as just having a food support available that's available for pickup at the clinic. We also have expanding programs that address loneliness and increase social connection in older adults. So later on in the session, we're going to have Sage Metro Portland come, and they're going to really kind of be able to draw some of this direct connection for you, because they really work on LGBTQ elders and making sure that they have housing available and have equity and just anti-discrimination within that. So they're going to kind of help us draw that really direct connection between the social isolation in older adults and being able to find affordable housing. And then also within healthy communities, we have centering BIPOC, American Indian, Alaskan Native communities in decision making about land use planning and zoning. So it's really about having that communities be able to have a part in that decision making and make sure that there's accessible, affordable, and that there's healthy neighborhoods. And then finally, we do know that there is climate resilience is also, of course, tied into all of this. It's tied into housing security, it's tied into food security, it's tied into having a food resilient system. So we know that especially in the years to come, climate resilience is going to be an increased topic that's related to both housing and food. So it's really about building that climate resilience among the priority populations. Within equity and justice, we know that we want to really build upon and create BIPOC, American Indian, Alaskan Native-led community solutions. So again, are we sourcing those solutions from the community? Are we sourcing solutions from housing from the community? Are they driven that way? And then also making sure that we're sourcing those solutions to address the systemic bias and the inequities. We do have under equity and justice as well, we have reducing legal and system barriers for immigrant and refugees communities, including people without documentation. So when we're talking about food supports and we're talking about food supports programs, are we really reducing those barriers and making sure that they're available for all communities, including immigrant and refugee communities as well? And then finally, under behavioral health, we have creating state agency partnerships. So state agency partnerships in education and housing and public health. And we're doing that in order to improve the behavioral health outcomes among Black and Indigenous people of color and American Indian and Alaskan Native. So thank you very much for this kind of sitting through this. This is sort of we just really wanted to give you an idea of really what's in the plan and let you know, that this is sort of what is outlined in the plan, and that we know that there's a lot of related strategies, and just kind of give you an overview of this implementation area. And then next, what we want to do is really give the opportunity for you all to talk to each other. So what we're going to do is we're going to split up into breakout rooms because we really want you to have the opportunity to share some ideas and to share some ideas with each other and share some ideas with us. So we're going to take about 16 minutes in the breakout rooms, and we want you to do 3 things during that time. So we want you to introduce each other, your name and pronouns, your role or agency, and where in the state you're located. We also want you to have some dialogue about the strategies that we've just presented. So share some examples of how your community is advancing these strategies. And what do you see happening that's working? And what do you see happening that's not working? And then also discuss the priorities. So as we mentioned, we have this amazing external partnership, which is our community steering committee that's the decision makers for the plan. So if you could advise them on activities related to housing and food in your area, what do you want to see? What would you tell them? What opportunities for the future do you want to see? What activities do you think should be prioritized? So we're going to go ahead, like I said, and split folks up and have a little bit of time for you all to collaborate. And what we'd like to do during that time as well is we have a Jamboard, a Google Jamboard, and it has all, we'll drop the link in the chat to the Jamboard. And you can also, the questions are located there, so you'll be able to see them during your breakouts. And then click on that Jamboard and then just add some Post-it notes. So under housing and food, there's a page for a couple pages for each of these. So a couple pages for number 2, a couple pages for number 3. So at this time, we're just going to go ahead and break out and let folks be able to talk to be able to share some ideas amongst yourselves. And then afterwards, we're going to come back together and then we're going to have some presentations. We're going to have Oregon Housing Community Services. We're going to have Rogue Food Unites, and we're going to have Sage Metro Portland join us and let us know about some amazing work that's happening in these areas.
All right, Liz, we've got breakout rooms ready to go. We'll see you back here in 8 minutes. Have fun, everybody.
Thanks, everybody. We're just going to give a minute for all the folks to trickle back in from their breakout rooms. Okay, I think we can go ahead and get started. All right, so for the final part of our session today, we're going to hear from 3 agencies with example of work that's going on happening in the housing and food arena and its strategies. So first, we are going to be joined by Kate Gonsalves from the Oregon Housing and Community Services. And we're very thankful for OHCS for coming to present today. Kate, you want to go ahead and introduce yourself and your role?
Good morning, everyone. My name is Kate Gonsalves. I use she, her pronouns, and I'm so pleased to be here with you in virtual community. I just a disclaimer, am senior communications here at OHCS, but our policy and program staff weren't available to be here today. So if there are really kind of nuanced, wonky questions, I'm very happy to take those back to the team and get you all answers. So just wanted to do that disclaimer that I'll kind of be doing the 1,000 yards from above, picture of some of the intersections with housing. I just want to say that it was so wonderful, Liz, to hear about your state health improvement plan, and I was thinking about how Healthier Together Oregon, your strategic plan is really so aligned with ours, and we're just really thrilled to be partnering and trying to build more inclusive and thriving communities with you all. So thank you for this invitation, and we look forward to extending agency invitations to you all to come present with us, and any of the community groups on this call. We would welcome your partnership as well. So I'll just say I've been in this role for about 1.5 years. Prior to this, I came to this work from the ACLU of Oregon, but I am very passionate about the social determinants of health. And so it's wonderful to be here and be thinking about how all these pieces fit together. I think increasingly with the pandemic, we're really seeing that having a warm, safe, dry place to call home is more important than ever in a global pandemic. But as you all are very aware, with those intersections of the social determinants of health, housing really has an interplay with, what schools you go to, whether or not there's food deserts where you live, whether or not there's over-policing and toxic stress, or if you have opportunity for jobs and connections. It just really has so many intersections to all the work that many folks on this virtual call are engaged in, and just want to offer appreciation for everyone on this call for the work you're doing. So for those of you who are unfamiliar with our agency, and again, that's Oregon Housing Community Services, we're the state's housing finance agency. And so we provide resources for Oregonians to reduce poverty and increase access to stable housing. I want to point out that we're a little unique than many other states in that we combine both this financial services arm with the community services, and that's kind of unusual for a lot of states. But this intersectionality and really intentional focus on both the housing and the services across the housing continuum really allows us to be intentional. And so we cover everything from preventing and ending homelessness, to assisting with utilities, to providing housing stability supports, financing multifamily affordable housing, which is, getting more affordable housing in the pipeline to build more homes because there is a chronic shortage, and encouraging home ownership. And so similar to OHA, we have a statewide housing plan that we launched in 2019 with equity and racial justice as a foundational guiding principle and priority. And we really believe that by centering racial equity into all of the housing and community development strategies that we have, we're striving to ensure that BIPOC and tribal communities are centered instead of disproportionately burdened by our policies and practices. And with that, we believe that calling for racial justice isn't enough, that we have to proactively take measurable steps to achieve it. And so in that work, this moment really calls for us to acknowledge the ways in which banking institutions and housing finance agencies have in many ways historically failed communities of color and vulnerable communities. And in many ways, white wealth was really built off the labor and plunder of Indigenous, tribal, Black and Brown communities. And so these investments, or in many cases, chronic divestment, were not race neutral, nor are they frozen in history. Instead, the racial wealth gap continues to perpetuate and limit opportunity. So I just want to point out that, all of these kind of invisible structural processes are often rooted in de jure and de facto practicing of redlining, urban renewal, restrictive covenants, biased mortgage lending practices, chronic divestments. And so housing finance agencies have historically contributed to these, seemingly blameless widespread practices that really entrench modern day inequity. And they have set the stage for a widening wealth gap. And negative social determinants of health for communities of color. And so we really see it as our job as a housing finance agency to undo these historic wrongs. And so we're harnessing our power as a housing finance agency to really be intentional about the fact that budgets are often moral documents. And so we're using our statewide housing plan to anchor our work. And so I'm here today mainly just to talk about homeownership, but I would really encourage you to do a deeper dive into our other priorities in the statewide housing plan that do really intersect all along the continuum. I do want to point out that while I'll talk about HOPE and Senate Bill 79, which was the issue I was asked to come here to talk on, we are really caught up in emergency response programs, like I know many of you out there are, and I want to just use this opportunity to elevate Oregon rental assistance that is available. There are many households at risk of eviction who may not know rental assistance is out there. There's $204 million. So the Oregon Emergency Rental Assistance Program is live, and households are given additional protections under Senate Bill 278. If folks apply for rental assistance, they will receive eviction protections for 60 days or 90 days in Multnomah County. So just wanted to use this platform to spread the word about those rental assistance resources really quickly. But now I'll kind of pivot back to homeownership, which is the issue I was asked here to come and speak on. So as many of you are aware, homeownership remains the principal ways that most families build wealth in this country. And the gap between the homeownership rate between Black and white families in the US is bigger today than it has been in many decades. In particular, Oregon's racial disparities in homeownership are staggering. The Black-white homeownership gap has increased over the past 30 years. Statewide, the homeownership rate for Hispanic and non-white households is 43% compared to 64% for non-Hispanic white households. So in our work, and you can see this under the statewide housing plan I referenced, which I can drop a link to at the end of this discussion, but OHCS is working to double the number of homeowners of color in our homeownership programs, and that's part of this concerted effort to bridge the homeownership gap for communities of color. We're strategically building partnerships and engaging with culturally specific and culturally responsive organizations to connect communities to homeownership programs and assure that these programs are in line with community needs. We're supporting low-cost homeownership opportunities through preservation and improvement with manufactured housing opportunities. I won't go into depth about all of the wildfire response we've been doing, but it was just the 1-year anniversary from the Labor Day 22 Oregon wildfires, and thousands of homes were destroyed in those fires. Many of them were manufactured housing, and we've launched several programs to provide stable housing for communities that were most impacted, and that's some recovery work that is continuing to move forward. And so finally, we're also really focused on supporting and expanding programs to support homeowners to stay in their homes and keep them. And I'll talk about that a little bit towards the end, but I just want to touch upon Senate Bill 79, the HOPE program, which is one of the programs you all were most interested in, I believe. During the last legislative session, we had a major, I think it was doubling of our resources, which is extremely exciting. But one of the policy wins was Senate Bill 79, and I'm sure many partners on this virtual community call may have been engaged in those discussions and maybe know even more than I do about all the policy specifics. But basically, the purpose of the HOPE program is to expand access to home ownership for Oregonians earning below area median income. And so Senate Bill 79 expands the use of the HOPE program to strategically increase home ownership in BIPOC communities. It delivers financial coaching and counseling to prepare Oregonians to buy homes, but it offers down payment assistance to assure home ownership is accessible to all. And it's funded through the document recording fee. One really exciting piece of this bill moving forward is that it expanded the program for Oregon's 9 federally recognized tribes to administer HOPE programs in their own communities. So we are currently continuing to work on rulemaking, which the bill goes into effect, I believe, in January, and then we'll continue in the first quarter of next year working on rulemaking. But it's a really exciting policy win. On that note, so homeownership was the issue you're most interested in, and we have that kind of under different buckets of divisions in terms of some of the exciting things that we're doing that have overlap. So I just want to flag the LIFT program that folks may or may not be aware of, but in 2015, this program was created, and the Oregon legislature is using these really innovative ways of utilizing Article Q bonds, which gets really wonky, but basically it's brought in a historic $303 million to be offered for this next biennium, and it's brought over 5,600 affordable housing homes online, including 480 of them are home ownership opportunities to and that program is really focused in on historically underserved communities. So it has an intentional focus on communities of color in both rural and urban areas. And then, and Liz, feel free to start waving at me if I start getting up against time, but I'm just flagging a few more exciting programs we have that might not be on folks' radar. One is permanent supportive housing, which Liz referenced earlier, but it's one of our statewide housing plan priorities. And folks on this call are probably aware, but it's a really proven model that helps some of our most vulnerable community members find shelter, but beyond that, find housing and stay housed long term. So we created a goal to create 1,000 permanent supportive homes in 5 years. And I'm really excited that we're nearly to that goal, which is a few years ahead of schedule. Some of that might be attributed to our Supportive Housing Institute that we launched. We just had our second cohort graduate. So again, happy to connect at a later date about permanent supportive housing and the wraparound services that are so critical in connecting folks to housing. Also just wanted to flag the down payment assistance funds, which housing counselors can provide more information about, but these down payment assistance funds are awarded to organizations throughout the state to create and expand existing down payment assistance programs. And again, there's a lot of historical inequity that I won't get into about why communities of color often have been barred from having down payment assistance from, predatory banking or use of credit scores. There's all sorts of reasons that people have trouble sometimes getting a loan. So this is a really critical program. Liz also mentioned the IDA program, which were huge champions of which Neighborhood Partnership the initiative, I believe they call it. And again, those are matched savings accounts. So really great thing for folks to be aware of if your networks aren't already aware of them. And then I want to just briefly mention that folks may not be aware, but the foreclosure moratorium was extended by the governor until December 31st of this year. And that's really, really critical because, in previous economic downturns, we saw that they are not at all race neutral, and that communities of color were often hit the hardest during the economic downturns, and that Black homeowners in particular were, preyed upon by many subprime loans. And so this is something that folks may not be aware, that there are resources coming online. So when the coronavirus pandemic hit, our agency launched into action to work with our federal delegation so that we could utilize these hardest hit funds to move towards the OHSI program for folks who were dealing with foreclosure. And we were able to help thousands of Oregon households avoid financial hardship as a result of the pandemic. But later this year, the Homeownership Assistance Fund will be coming online. Oregon is set to receive $90 million from U.S. Treasury to distribute again to homeowners in danger of foreclosure who have experienced financial hardship related to the pandemic. So we're currently set to launch a pilot program soon, but the HAF program will be coming online later this year. So that's something really important to have in the back of your minds. It's not up and running just yet, but we do have information about it on our website. I guess just kind of bringing things to a close, I would really love to just promote Oregon's housing counseling centers and the home ownership centers that are across the state, and I can drop a link to them at the end of this presentation. But they provide a whole host of counseling, purchasing, opportunities for first-time home buyers. Many of the different resources I mentioned, they are very aware of and can counsel people on based on their particular financial situation, and they might have more things on their radar about what's available in local communities. So anyone who is engaged in housing navigation, definitely connecting folks to their local community home ownership center is definitely kind of my final resource I'll share today as probably the next step as an action item. I do have several different resources I can drop in the chat at the end if that's most helpful, is to get out information about some of our recent legislative policy wins that might be of interest for this group. I did not go into the long litany of home ownership and affordable housing programs that are being launched, but some of them definitely have overlap with some of the work you're doing and might be interesting for folks on this call to read more about.
Yeah, that sounds great, Kate. And then also, we will be sending out a follow-up email with folks too, so we can kind of collate those and get those out to folks as well. So in case people want to pass them off to other people in their organization and share those resources too, we can send those out as in our follow-up email, because we will send the slides and we'll send the recording, and we can send any resources that you provide as well. But thank you. There's a lot going on in this area, I know. So I really appreciate you taking the time to kind of talk us through some of the amazing stuff that's available. So very much appreciative of your time today, Kate.
Great. Thank you for having me.
So next up, we're really excited to have Rogue Food Unites come speak as they've been doing amazing work in Southern Oregon around disaster relief and supporting vaccine efforts using an incredible innovative model that supports different facets of the local food systems. So Adam Danforth is here from Rogue Food Unites to tell you more, and I will let him introduce himself.
Hi, Liz.
Hi.
Hi, everybody. Thanks so much for having me here. Kate, thanks so much for delving really deeply into all the programs that are happening at HCS as well. That was really helpful. Looking forward to hearing from some other people after me as well. So I'm Adam Danforth. I'm one of the co-founders, co-directors of Rogue Food Unites. And we are a new nonprofit in Southern Oregon. As Kate mentioned, we had just recognized the 1-year commemoration of the Labor Day fires that happened last year. And we're in Ashland, Oregon. And one of those fires, the Almeida fire, as some of you probably know, ended up hitting some nearby towns, Talent and Phoenix especially. And so in response to that, this idea arose and sort of emerged in the immediacy afterwards of how do we help direct federal aid money that's coming in to support people during crisis through community establishments and through community businesses in order to not only help people in order to meet the initial feeding needs of people who are suffering from a crisis, but also help uplift the community as a whole and also help the economy that surrounds them so that they're held in their recovery process in a really sustainable way. So at the time, this was September last year, and the restaurants had a massive amount of unused capacity. They were going through a lot of their own struggles. So as we do now, there were many concurrent sort of crises going on. And I think one of the ways in which all of us can consider how we respond to any single crisis is really looking at the intersection of other concurrent crises that are happening and how do we help these, because they all have impact in ways at the same time. Certainly the pandemic has a sense of universal impact, and then we also have aspects of the fires that have localized and community-wide impact. And we have social justice issues going on, and we have other issues that are going on as well. And so all of those are factors that we feel need to be considered when we really look at, like, how do we center the immediacy of people's needs in order to recover from one specific crisis event, and then how do we take into consideration all those other intersecting elements that are happening at the same time. So I say that in reflection because at the time, of course, that we were figuring out, like, what do we do? It was our own crisis, and we were just trying to figure out, we have over 2,000 homes that just burned, and how do we meet the feeding needs immediately of many thousands of people who were displaced? So, the idea was utilizing food businesses locally. Those are locally invested, locally owned food businesses, and that includes restaurants, that includes catering, that includes food trucks, that also includes farms and co-ops and small product producers. And how do we bring in that federal aid money that's coming into the region and then pay local food businesses in order to produce all the needs that we have in order to then meet the ongoing feeding needs for people who are needing to recover from that crisis. How we saw that was not only that those food businesses have the capacity to meet the need, but also by really realistically saving those food businesses at the same time, we're not only continuing to support the people who are in immediate need of food support, we're also supporting the businesses that they own, the businesses that they work in, the businesses that they work in the fields, the businesses where they're supporting in other sort of manners. And food businesses themselves are uniquely positioned because they are one of the most efficient recirculators of revenue in a local economy. So if we focus on locally owned food businesses, we can also help recirculate up to 65 or 70% of that revenue locally. If you consider how especially restaurants work, there's a lot of concomitant businesses that are also really required in order for them to function. Those could be, fish businesses, so it could be butchers, that could be distribution companies, that can be, linen companies, all kinds of different ones that are also engaged. So that was really part of the idea as well, is that when you engage food businesses, you don't engage a singular business, you're also engaging an entire network really of businesses. So from that, we really, our mission developed, and the Rogue Food Unites mission is really that we use food to heal individuals and communities during times of crisis. So this is really a focus as to sort of like how food can serve not only to meet the human right at a time when people need it most, but really also as a conduit for re-knitting together a community, for reconnection between individuals and also support of individuals during that time. I think many, what we've learned over the last year and being a new disaster relief organization is also reflecting on the ways in which we've seen disaster relief show up in other times, in ways in which people who are attempting to recover are dehumanized, are not recognized really for what they're going through, are reduced to sort of statistics and numbers. And I think the celebration of community through food is one of the ways that we continue to humanize people during that process of recovery. We connect with them every day. We're there for most meals. We're there to support them with an essential need that does occur every day over the long haul of the recovery process. So in doing so, we not only remind them that their community is still there, that they're recognized really for the struggle that they're going through, but also that they're held by a greater community of people who are recognizing, the resilience and in solidarity really for what they need in order to recover. And in that year, a lot has really happened, a staggering amount really, not only for us, but also for the world at large. I think all of us as individuals have probably gone through more in the last year than any of us could have probably imagined that we would need to go through. So there's certainly a level of resilience that I feel like has been the theme for many, many people. And as we look at the recovery process from those fires and how we've supported, our programs have certainly changed in order to adapt to that. So in the immediacy afterwards, we were developing really all hot meals. So we distributed hot meals in many different ways through distribution sites, at hotels where people were sheltering, and also just door to door in the communities that were either burned out or impacted by the fires. So through the first several months, anywhere from 2,000 to 4,000 meals a day were really being delivered in that manner. In many cases, we were delivering over 500 meals, dinners a night, door to door through these communities, through a really unbelievable network of volunteers and coordination that just sort of like emerged from the community. So that was one of the many just amazing things that happened in the aftermath of some sort of event like that. So when people really need food as and handed to them in a way with care and recognition, with cultural consideration, that was really the initial process. And as the recovery continued, our programs developed to meet those as well. So, anybody in the hotels and even outside the hotels, there's dietary restrictions, there's mobility restrictions, there's work schedule restrictions, there's many other limitations for how people can access food. So we also had to develop a voucher program. So after that, we developed a program in which we source from again, many different local restaurants and also multi-purpose grocery stores in order to provide people with a deserved per diem in order for them to be able to have aspects of independence and agency and choice, not only in the timing in which they ate, but also if they have dietary restrictions or other things, then they're able to choose many of the things themselves. Some people were ready for that. Other people at the time weren't ready and continue on hot meals. To this day, we actually, I take that back. To last Sunday, we've delivered hot meals to the hotels until last Sunday. That was actually the last day that we were doing hot meals at the hotels. And through that process, we continued lunch and dinner every single day at all the hotels, not only in Jackson County, but we also, after October, we're asked to cover 4 other counties. So we're also the state contracted agency for evacuee feeding in Deschutes, Douglas, Klamath, and Josephine. So the hardest hit was Jackson. So to this day, I think we probably have across all 5 counties just under 600 people that are still in hotels, and the vast majority of that is still in Jackson County. As people moved outside the hotels, they moved into, let's say, FEMA housing parks and also RV parks. So there's that stage of transitional housing between really long-term housing and in the short-term immediacy of needing to be in a hotel. And in those situations, people have the ability to cook for themselves, whether or not they have the wherewithal for various different reasons, whether or not it, it depends on timing, emotional capability, other sort of considerations. We don't want to expect everyone to suddenly be able to move from a hotel where they had meals provided to them to suddenly be completely self-sufficient. So we have a transitional program that does meet them there. We provide provision boxes that include that every week to them, that includes enough food for them to be able to prepare meals for themselves. Some of them are restaurant designed, pre-prepared meals as well. And then we also have like a process of being able to build your own pantry over the first several weeks. So we're providing, the goods that people need in order to build, again, culturally appropriate pantries for them to be able to rise to that level of self-sufficiency. There's also a lot of beautiful seasonal perishable stuff in there that would be, vegetables and dairy and meat that we're also sourcing from places that reflect the ethos and the mission of our organization. So as we developed that, we were at hot meals in the hotels. We were at Voucher Program also in the hotels, and then provision boxes outside the hotels. As I mentioned last Sunday, the hot meals ended at the hotels, and we've transitioned all the hotels to something that we call the Oregon Solidarity Card. It is a remote loaded debit card that provides a weekly per diem to people who are still in hotels, that enables them to be able to purchase meals and food in the way and where they want. It's restricted to grocery stores and restaurants, but it does support, if you have mobility restrictions or other things, you can use it for delivery services. If you're able to visit restaurants, you're able to use it there, including food trucks and farmers markets. And then you can also use it at grocery stores. So it really has provided people with a certain level of independence at this point that I feel like they deserve after being in a hotel for almost 12 months. A really unforeseeable amount of time that they've been there, with an unforeseeable amount of time really left to be there. So hopefully that's meeting their needs in a really, really great way these days. Additionally, and thanks to OHA as well, we've been asked to also support the vaccine missions that have been happening this year across the state. Again, with perishable or non-perishable food boxes at many of those events that are happening across those 5 counties, as well as in Curry County and Grant County. Really grateful for that opportunity. Again, it contributes to this idea of community health, which we're really invested into. And also in this continuation of partnerships with other CBOs and really mutual aid efforts that are happening in order to support that community health idea. Certainly, as we look to the future as an organization, we have to consider, like, what does disaster preparedness mean? And for us, disaster preparedness really looks at community health overall. What does that mean for people's resilience that they can dig into in order to respond to any sort of emergency or disaster? And also, what is regional resiliency? What is the regional food shed really look like? What is the independence that's there for people to be sustainable and persist in times of emergency? So those are all questions that we're asking a lot. We certainly don't have any of those answers, and working with other people to sort of figure out, like, how does that fit into a situation, especially in Southern Oregon, where we're also going through such immense drought, that we have impact into what we can do from an aspect of food production. So as much as we try to uplift farms and food production areas within this regional context, there's other crises that are impacting that as well, like the climate crisis. So for us also, some of the questions that we're asking, and I would love to follow up with people afterward in conversations is sort of like, how are we prioritizing human wellness in relationship to non-human wellness? And as we look to, what is the impact of our work into areas that have to do with contributing to a climate crisis, contributing to a deterioration of wellness of the world at large, of nature and ecosystems, and how are we prioritizing the immediacy of human needs, and also centering the longevity of really what we do in order to support recovery with a long view of sustainability and really being a positive impact organization. I strongly believe that if we operate as an organization and at the end of the day that we have a negative impact overall on the world with a carbon footprint, with other sort of packaging considerations and waste and things like that, that it's misconstruing sort of the priorities in that sort of regard. So many of the goals of our programs as we look ahead as well are centered on looking, how do we ensure that we really have a positive impact in the long run, while we also have a positive impact in the immediacy as responding to disasters. So last month we moved into our first permanent office, which was really a quite exciting sort of event for a fledgling nonprofit like ours. Also, thanks to a mutual aid partner, the Ashland Emergency Food Bank, for supporting that. Grateful for the support of many organizations in our community for really accepting us as a very new nonprofit in the work that we do. United Way of Jackson County is another one. All Care has been one. And Rogue Action Center, and I don't know if any of you are on this, but they've all been really, really great supporters. And in that new space, as we continue to look to new projects, it's also centered really a lot around community health, community gathering. And when we can do that again, of course, any sort of gathering outside of these virtual spaces becomes really challenging these days. Looking forward to when we can eat together, sit across from tables together, sort of like hug each other in this sort of way. And in that same regard, bring people together who are from various backgrounds, lived experiences, disaster experiences, crises, and really just gather around food, celebrate other people's cultural comforts around food, integrate other people into the production of food, and really use that as a space for people to heal together, and have food as that, continue to have food as that conduit to really foster a community that can run deep enough to really have this like emergent disaster preparedness around it. So many of the things that we look to in that regard as well. And I also really loved hearing Kate speak to aspects of how they're also centering some of the efforts around social justice and dismantling systems, and the focus on housing and the housing crisis. Certainly another one that intersects with all the work that we're doing is access to housing. Really the only reason people are still in hotels is the limitation of that. So, food is one human right, shelter is certainly another one. And while we provide food, the access to shelter is certainly one of the limitations of how we can help people progress in that recovery process. So I think there's enormous conversations to be had as far as how housing is really in so many ways the bottleneck for certain areas of recovery, and how does that how do we better support the houseless community as well, because they intersect with all these areas too. The climate crisis and wildfire crises and social justice crisis, all those things in many ways end up contributing to houselessness that needs our support in many different ways that challenge stigmas that are long held. So we also focus on those issues too, and are looking forward to many programs out of our new space that continue to involve those communities as well. Liz, I think I've run over time. You told me 10 minutes, and I appreciate the grace in allowing that. That feels like a great place for me to come to a conclusion. Thanks again for really allowing that much space to talk about what we're doing in Southern Oregon and hopefully beyond.
Yeah, thanks, Adam. And I think that is a really great, it's a great wrap up, really, because we do know that, housing and food are just, they're such interconnected areas. So we can talk about the need for food security, we can talk about the need for housing security, but we just know that these really are so connected together. So I really appreciate you kind of drawing that, kind of link at the end. We were supposed to have Sage Metro Portland to be able to come and present today, but they're not able to make it. So it's perfectly fine, Adam, that we went a little bit over. I am going to drop the link into the chat so that you can kind of take a little bit, a look at the work that they do, because really what their work is kind of focused on is just kind of addressing discrimination in housing. So they do some really great programs for LGBTQ seniors, and they're able to refer folks into affordable housing and other housing. And then they're also really able to do some really amazing equity and advocacy work for LGBTQ seniors. So if they, are looking for senior housing that's friendly and senior housing that's a welcoming environment for them. So we are bummed that we're not able to come today, but we're definitely encourage you to check out what they do. And like I said, that link is in the chat. So thank you. I wanted to go ahead and wrap up today. Christy, do you want to go ahead and launch the poll? So we wanted to just ask folks, so what is one next step you'll take as a result of this webinar? So we're just kind of curious to what your next step is. I know one of our next steps here is that we are going to be sharing the Jamboard and your ideas that you all gave to us during your breakout sessions. We will go ahead and share that with the partnership so that they're able to see some examples of what's happening in your area, see some examples of things that are rising to the front. So we really wanted to, thank everybody for their participation during the breakouts and being able to contribute some information and some ideas, and hope you guys felt it was great to be able to connect with one another around these areas. Okay. Thanks so much. So it looks like we're going to have some sharing with a colleague, some connecting offline, and then definitely researching particular strategies, which we love. So we also wanted to let you all know some final kind of wrap up steps. So we wanted to say thank you to everybody for presenting today. We want to very much thank Oregon Housing Community Services and Rogue Food Unites for really sharing some really inspiring examples of how you're advancing equity. We do want to invite you to join us for our next event in the series. So that is at we'll go ahead and send that out again in our follow-up email to you, but that's in our HTO and Action page on our state site. And then also the recording and slides will be available. And like we said, we're going to send you all some good follow-up information. And you can also feel free to email Public Health Policy. We do have this Basecamp, which is an online collaboration platform. So if you're interested in joining that online collaboration and having some dialogue with other folks, please do email us and we can get you invited to that Basecamp to share resources and participate in some dialogue around some of these strategies and implementation. And then also we do have an evaluation survey. So please do feel free to take that and let us know what we can do the next time to make this space really as collaborative and as helpful to you all to understand. So thanks so much, everybody, for joining today. We really appreciate your time. And I know we're just 1 minute over and we will let you guys go on to the rest of your day. But thanks so much for joining us and talking about housing and food. Have a good one, everybody.